Good evening, everyone. On behalf of the board and the co-chair, other co-chair, Dr. Don Schwartz of Healthy Philadelphia, I want to thank you for being here and welcome you this evening. This process of talking about healthcare really can't happen without your voices. And so I want to give you a little bit of background about Healthy Philadelphia, but really encourage you tonight to really make your stories heard and to hear from the organizations here about the resources that are available and that you can share with others. Healthy Philadelphia is a nonprofit organization that came together with the goal of helping to stimulate the healthcare system to provide better care to everybody, to expand the scope of healthcare to universal healthcare for residents of Philadelphia. And it came about as a result of a ballot initiative where people resoundingly supported the idea that we should do this, that we should develop a plan to move forward. In many areas of the city, across the city it was voted for overwhelmingly, 60% of the population. In some areas, like this area, 100% of people acknowledged and supported that idea. And so the work of Healthy Philadelphia has really been to be a convener, to bring together different parts of the healthcare system, to bring the knowledge of experts and people working in those systems to the table to talk about how can we improve the care that people get. How can we make sure that the care is more connected so that when people are seen in the hospital, that connects to their care when they get home? And most of all, how can we make sure that the voices of those people who are truly affected are a part of this conversation? And so tonight, I simply want to thank you for being here, to be a part of this process, to be a part of this conversation. And this is one of a number of conversations that are being convened by Healthy Philadelphia. So for example, we are currently working together with discharge planners and people who oversee the discharge process at different hospitals throughout the city. Really trying to address this question, how do we make sure that people, when they come out of the hospital, even if they got really good care in the hospital, we don't lose that good care because they don't have insurance when they get out, they're not connected to resources, they don't have a primary care doctor, they can't get their prescriptions filled. You have relatives, people, friends who have had those experiences. Those are conversations that are going on. But most importantly are your voices, those voices that we receive and participate in tonight will be presented back to the various groups that are coming together, so your voice and your voices and the voices of your family and friends will be heard in those places. And so once again, thank you for being here.